Review of the hybrid approach to CTO.
Thanks, Barry. And my task is in a 15-minute window to just give you a broad bird's-eye view and an overview of the hybrid approach. You learn the fundamental details of each of those in several talks today, and the more intricate details will be covered in tomorrow's presentations in the advanced workshop. These are my disclosures. So what is really the goal of hybrid CTO PCI? Well, the goal of hybrid PCI was to harmonize antegrade, retrograde techniques, whether they be wire alone and re-entry. In addition, we wanted to standardize both the initial and the provisional approaches to CTO PCI to facilitate education. The third major goal was to provide an opportunity to use the concept of conditional probability. And the last was to prioritize our efficiency, especially when equipoise exists with different approaches, to make the procedure effective, safe, and applicable. So what are the precepts of the hybrid approach? The precepts are as follows. The goal is to extend this therapy to all patients that need it with appropriate clinical indication, irrespective of the angiogram. Hybrid and antegrade dissection reentry overcomes a variety of technical hurdles that you usually encompass and are especially tailored for complex anatomy, post-CABG, and calcified lesions, which is what we routinely see in our day-to-day practice. Hybrid manages both radiation and contrast prospectively by allowing very triggered decision-making early on in the procedure. It also focuses on case efficiency. This aids in the workflow and acceptance of the procedure in our busy cath labs, and which we hope will drive adoption. The whole focus of the hybrid is achieving true lumen access rather than trying to cross the CTO, which is a marked distinction to the European and Japanese approaches. So what are the principles for CTO PCI? To make it simplified and to really make it understood uniformly, we like to really divide it in antegrade wire crossing, retrograde wire crossing, antegrade dissection reentry, and retrograde dissection reentry. What that does, it takes away the terminology, jargon that can be awfully confusing. Terms like cart, reverse cart, things like that can really be simplified into retrograde dissection reentry, antegrade dissection reentry being the alternative form of reverse cart when performed antegrade. The principles usually relate to the anatomy,